All righty, everyone. Good afternoon to those of you on the East Coast, to those of you in the Western portion of North America, Central Time, Mountain Time, Pacific Time. Good morning to you. Thank you for joining us. This is day number 7 of our How to Make Your Medical Exercise Training Practice Referral Ready in 30 Days. I'm Dr. Mike, and we're here to share our expertise, tips, knowledge, ideas on how you can become referral ready in 30 days. Now, notice we use the term practice, folks. A lot of you use the term business. Here's why we use the term practice. A practice is a professional service that produces outcomes for its clients based on the skills and knowledge of that professional. Based on that skill and knowledge, clients continue to come back or refer others. A business, on the other hand, is always trying to acquire new clients. That's the most essential thing in the business, acquiring new clients. We want you to develop a practice where the outcomes you produce bring clients back, and as they come back, they also bring other clients or new clients in. And I'll tell you a little story. Years ago, I lived in Sacramento, California. I had an eye doctor there, and this guy was fantastic. I would go in and get my my annual exam, and we ended up talking about golf for the first 20 minutes, and his assistant would have to come in and say, "Hey, guys," or boys, because we were acting like two little kids. He needs to get his exam done because we got patients waiting in the waiting room. This guy was fantastic, the optometrist. So one time I went to Toronto to do an MES course. And while I was there, I developed an eye infection because of a contact lens I had left in overnight. Well, I called this guy in Sacramento. He said, "Okay, give me a few moments, call me back." So what he did, he called a friend who went to optometry school with him here in the United States, but practiced in Toronto. I called him back about 15 minutes later. He says, "Call this guy. He's going to get you all taken care of." Because remember, medical services, or at least referrals, don't cross the border. Well, I called this guy in Toronto. He told me to come over to his office. Within an hour, I'm there and I'm getting treated for my eye infection at a minimal cost. Now, from that point on, even when we moved to Texas, when I had an opportunity to get back to California, I would go back to see this guy. That's how you build a practice, by producing outcomes for your clients. So we want you to build practices that are based on the outcomes you produce for your clients. And with that said, today we're going to talk about document your practice standards. Now, here's the deal. I know many of you are solo practitioners, as was I when I started my first physical therapy clinic. But I realized I needed to put things down on paper. You have to put things down on paper. You have to document your practice standards. This means from the intake that you do with new clients coming in. It means how you manage the clients once they get in the door, from scheduling to charging them or billing, to documenting, to sending out reports or progress reports to their doctor, therapist, or chiropractor. You have to document everything. And you say, "Well, Dr. Mike, how do I do that?" With this thing right here. Guess what? Your cell phone actually has the ability for you to dictate into it, and it will produce a text document. Now, all of this stuff is in your head. Everything that you do in your practice is stuck in your head. You don't want to sit there and write all of it down. So take your cell phone one afternoon or one evening when you're sitting around watching the NBA playoffs or watching the, was it XFL? Just sit there and dictate how you go step by step through the process. We'll talk about that a little bit more. Now, please remember, we have a number of manuals that are available for you. We realize for many of you out there, you're trying to build a medical exercise training practice. You haven't done this before. So we've produced a couple of manuals. These are digital manuals through the special offer we have here. Our Cracking the Code manual, which takes you step by step through the process of insurance billing, as well as getting your practice ready for insurance billing, which means setting up systems, guidelines, procedures, paperwork. We also have our Advanced Medical Exercise Specialist Manual. I'd advise you to get this. It is 1,228 pages. It is every procedural process we've learned, from protocols to guidelines to forms, and many of the things we're going to talk about today are in that AMES manual. We put both of them together as digital products for $199. I would urge you to get that and get the digital product, because you can take it any place, every place with you when you're working with clients. And with that said, we're going to talk about documenting your practice standards. Now, remember your scope of practice: medical exercise assessments, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, aquatic training, and stabilization training. Now, you say, why do you go over this every time, Dr. Mike? Because folks, you have to understand, you must stay in your lane legally, and you can't go over into the therapist lane, physical occupational therapist lane, or the massage therapist lane, or the physician's lane. The reason is, folks, you won't just get your hand slapped. You may actually end up with a lawsuit, or you may end up being prosecuted by the local district attorney or the state's attorney, or for our friends in Canada, the Crown Counsel, because you've gone out and you've done massage when you're not licensed. You provided ice packs or hot packs or cold packs, or you've done something like joint mobilization or soft tissue mobilization that is beyond your scope of practice, and that is illegal in many jurisdictions. I'll be remiss if I didn't advise you that every time we talk about making your practice referral ready. So with that, first thing we need to do is talk about the idea of documenting your intake and full management system process. So stop and think about it. When a new client comes in the door, what do? When that client calls, what's the first thing you do? What's the next thing you do? So the client calls, you communicate with them, you set up the appointment, and with that, you also get a little bit of background information on them. Where do you record that information? And is there a written step-by-step process that you follow? Once the client comes in for that first assessment, do you document it? How do you charge them for that first session? And then how do you make appointments for subsequent sessions? Where do you maintain that documentation? And with that, from that point on, as you're managing this client, how often are you sending reports to their doctor, therapist, or chiropractor? Along with that, what format or what form are you using to send that report? Are you emailing it? Are you mailing it? How are you communicating? Do you have a fax machine you could communicate with the doctors with, office via, or is it all email? Who do you contact at the doctor's office? So you have to document every aspect of this. And I told you earlier, folks, use your cell phone. I use a app called Google Keep. I just simply dictate into the app if I want to maintain a note. But also, many of the things that we put together in our AMES manual over the years, as we've worked with MESs, we've just simply taken the guidelines we put together, we dictated them, then we went back, edited them, cleaned them up, and then over the years, we just simply published those because we had an idea of exactly how a medical exercise training practice should work. It's based on what we did in our physical therapy practices. So you have to be able to document your intake and full management system. That becomes vitally important. Folks, it's not real in your brain. It's not real until you put it down on paper. And use the electronic system. Put it down in an electronic document, then you edit that, put it in ChatGPT, ask ChatGPT to clean it up, and then print it. Now, if you save that document every time you come back and you need to make an upgrade to it, or update it, guess what you do? You open up that document, you make the update. Folks, I know it's amazingly overwhelming to take all that information in your head and put it down on paper. Use this guy right here to help you. That makes it digital. Then you can print it out, you can edit it, and then save it and subsequently make updates to it along the way. So document your intake and full management system. I'll show you something in a few moments that will help you with this. Next along the way, make the steps simple and reproducible. Folks, don't make it rocket science. Make it as simple and easy as you can, because I know all of you want to expand your business. You want to add additional staff members. So myself and my business partner did this, almost 35 years ago when we opened our first PT clinic. We actually sat down, and we had the old clunky computers back then. And we sat down one night in my basement, and we just simply walked step by step through every procedure necessary when a new patient came into our physical therapy clinic. You can use the same guidelines for what happens in your medical exercise training practice. Obviously, you're not providing any therapy or any treatment. Same process. That new client coming to your office is the same as a client going to the dentist office, to the massage therapist office, to the doctor's office. And this afternoon, I've got to go to the dental office. Guess what? I'm going to do the same intake process there. Make the steps very simple and reproducible, so as you expand your staff, they can actually follow these procedures, and make it very simple so that a fifth grader can follow the procedures, but make it very simple so it doesn't take you multiple tasks to get something simple and easy done. Folks, keep it simple. KIS. Let's just keep it simple. With that, make sure you make it reproducible and think about it this way. If you want to expand your practice or you want to share this knowledge with with a medical professional so that they can see the step-by-step procedures, don't make it complicated, make it very simple, because you are going to share this with doctors, therapists, and chiropractors to the degree that you say, we do have a system. Here's how the system works. Guess what? Next step, share your standards with physicians and therapists. Folks, you got to remember, the medical community is looking at you as a medical exercise specialist and saying, where do you fit in? I'm not really sure, because they never used you before. They don't know what a medical exercise specialist is or a medical fitness specialist. They don't know. You have to educate them. So you're going to educate them with your elevator speech, with your bio, with your marketing materials, but also you now have standards that you've set up in your practice. And sometimes as you develop this relationship with the doctor, therapist, or chiropractor, you may say, hey, doc, here's how we handle new clients coming in the door, or therapists, here's how we handle clients that are ongoing clients and how we send the reports to you. What it does for them is it gives them a sense of, oh, wow, that's how you do it? Okay. That gives you trust. It gives you credibility. And it also now says you're a reliable professional. So share your standards with physicians and therapists, not as a marketing point, but once you've developed that relationship, let them know, here's how we do things. Now, I'm going to share something here with you. Now, I know this looks like hieroglyphics. This is something we developed several years ago as we started looking at medical exercise training being an essential and necessary component of the healthcare system. But we also took it a step farther. We needed to make develop a system for medical exercise professionals around the world to follow. So this is our medical exercise training client management system. As I said, we put this together several years ago. It looks like hieroglyphics. I know you're like, oh my God, Dr. Mike, that's everything we do. That's everything you do as a medical exercise professional. So you notice over here, we talk about the client intake, the initial client intake, the diagnosis. You don't diagnose, you're getting that from the doctor, therapist, or chiropractor. In your mind, you're doing a brief anatomy review when they tell you what their condition is. You're going to learn who the referral source is in that initial conversation. So they're calling you to say, or emailing or texting you to say, hey, I heard about you. I'd like to come in and get started with you. Someone referred me. Who's the referral source? Is it their doctor, their therapist, their chiropractor? In that conversation, you determine their medical exercise training or MET needs. This is where the communication can begin with their doctor, therapist, or chiropractor. In that conversation, you tell the client what the fees are, what attire they should wear. You schedule that first appointment. Step-by-step process, everything is there. In that initial session, notice we go from the intake to the initial session. There are two components. There's an administrative component and an assessment component. In that admin component, you now have admin forms, a demographic form, a release of liability, a release of information, a referral form that hopefully they bring in, or one that you'll send to the doctor so they can sign off on it. You select the appropriate assessment form, the appropriate functional assessment scale. If they have insurance coverage, you make sure you note that, take a picture of their card, make payment arrangements, and send the client alert fax to the doctor, therapist, or chiropractor asking if this client is appropriate for exercise. That's all the administrative aspects. Doesn't have to be done immediately when the client comes in, but it has to be done over that first 48 to 72 hours. The assessment component, you're going to get a medical history. You're going to conduct an interview. You're going to establish baselines for range of motion, function, strength, pain, endurance, stability, red flags, and does the client meet the criteria? Also, you're going to check their blood pressure, their heart rate. If they're diabetic, they're going to check their blood glucose level. You're also going to select the correct post-rehab protocol that comes in our AMES manual or in our medical exercise specialist workshop. And then you're going to determine the client's functional deficits. That's all in that first session. Now, that first session can be done over 2 sessions. But once all of this information is gathered, post-assessment, you have to write an assessment summary. We actually have forms that allow you to write the assessment summary based on what you found in the assessment. It's 1 page. With that, you're also going to identify functional outcome measures, the measures that you will use to communicate to the doctor, therapist, or chiropractor that the client is getting better, such as blood pressure, heart rate, strength levels, range of motion levels, things of that nature that are universally understood by physicians, therapists, chiropractors, medical and fitness professionals, as well as insurance carriers. You'll set goals, short-term goals that are reachable and achievable in 30 days, long-term goals achievable in 60 days, develop the MET program, refer back to those functional outcome measures, short-term and long-term goals as you put the MET program together. Determine if the client has any critical job demands that need to be addressed in the exercise program. If necessary, get medical clearance and forward that assessment summary to the physician, the therapist, or the chiropractor of record. Next, you schedule the sessions, determine frequency and duration, the dates and times. We recommend that you schedule at least 3 sessions after that initial session, at least 3. Put 3 on the calendar for the client. Make sure they accept and approve those sessions. So you got 3 on the calendar. And then now you start training the client. In every training session, we actually even have session logs you can use. In every MET training session, check the client status. How you doing today, Mrs. Smith? How you feel? What's happening? Any changes? Anything unusual happened since the last time we saw you? With that, determine the session goal or goals. You can have up to 3 goals. Check blood pressure, heart rate. Make sure they check their blood glucose level. If they're diabetic, record those numbers. Warm them up, train them, and document what you've done. Then periodically, we move from the training session to the progress report. Periodically, every 30 days or whenever that client is going back to their doctor, therapist, or chiropractor for a follow-up visit, you need to send a progress report. It should be how long? 1 page in length. Every 30 days or every follow-up visit to the MD, RPT, or DC, note the exercises and activities. Note any training recommendations that you have. And remember, you're an integral part of the management system for this client, and you're now the one managing the exercise. You're the exercise expert. Let the doctor, therapist, or chiropractor know what you're thinking as far as recommendations for exercise. If you think the client should engage in aquatic exercise, if you think the client needs more stretching, if you think the client needs a bicycle at home, send that information to the doctor, therapist, or chiropractor, where someone that's a licensed provider can make that determination, and maybe they can write a script for the client to get that from their or covered by their insurance carrier. You know, the plan of training or a plan of exercise. This is what the progression will look like over the next few weeks, and then focus on the goals and the functional outcome measures that you noted during the assessment and you put on that assessment summary. Now, lastly, notice we leave the progress report and we look at the MET management keys. These are the keys to managing a medical exercise training client. Number 1, make sure that you review the necessary anatomy and pathology of the client's condition. Anatomy pathology views. Number 2, reviews, excuse me, I should say, not views. Number 2, make sure you determine and understand the red flags that say the client is not appropriate for exercise, not just in the first session, but every subsequent session. Number 3, identify the functional deficits and functional outcome measures. That's why the client is coming to you. The doctor, therapist, or chiropractor wants to use exercise after therapy services are done to continue to improve this client's level of function. Identify those functional deficits, direct the exercise toward that. Develop that MET program, and it's based on short-term and long-term goals, which relate back to the functional deficits and the functional outcome measures or functional deficit numbers, the measures that you determine in the assessment. Document, report, and in that documentation and reporting process, do send an assessment summary to the doctor, therapist, or chiropractor. Do send a progress report, and when the client is finished and has reached their goals, and you're going to step them down from medical exercise training, maybe to just ongoing personal training, send a discharge summary. Simple as that. Now, everything here we've actually documented in our AMES manual. Everything here. We take you step by step through that process, or you can do it yourself by just simply following this flow chart, dictating it into your phone, how you do it, and then taking that document, putting it in Microsoft Word or Google Docs, editing it, and now you have a procedure that, if necessary, you could share with the doctor, therapist, or chiropractor, and it's just simply a numbered set of procedures. Now, with that, this is all part of our MES network, which will relaunch on May 22nd. We will put all the recordings from our Cracking the Code into this network, but we also will have an online community. We'll have more courses and more offerings for you that are specific to building your medical exercise training practice, managing your clients, and other tidbits and resources along the way that are designed specifically for you based on our 31 years offering medical exercise training services. So please, if you would, don't forget our Cracking the Code webinar series. We now are in the midst of our 30-day challenge to helping you build a medical exercise training practice that's referral ready in 30 days. Go over to crackingthecode.net. The recording for this will be up there later on today or tomorrow. And please remember, practice building tips. It's practice building, not business building, practice building. And thank you for being with us. So with that, I've been able to do this in under 30 minutes. We try not to keep you here more than 20 to 30 minutes because we know you're busy. So the recording for this will be up tomorrow. Please email me at drmike@postrehab.com. We will not meet tomorrow nor Friday. I actually have a couple of medical appointments myself that I need to attend to. Nothing major, just checkups and things of that nature. It's that time of year. So we will see you again on Monday. But please check out our blog. And if you have any questions for us, please email me at drmike@postrehab.com. We will see you Monday, but I will email you tomorrow and email you on Friday. And please, if you would, look for an email sometime around May 20th that will talk about the re-release or the release of our new version of the MES network. I think you'll find it interesting and helpful. All the best, folks. Take care. Thank you for joining us. Take care.